difficult to start their preparation, or they think that history taking stations are too difficult to start with. I think teaching stations are the right thing for you, because in teaching stations they will kickstart your preparation, and you will be able to talk about a lot of things, and you will start preparing. You have geeky medics videos for that. You have on this website you can get a lot of information regarding that station. So you can get the PDF file in your phone. You can read that blog or that notes, and they will help you a lot. In most common stations, among these most common stations, people find it difficult to talk about ECG teaching, or they found it difficult when they are asked to do urogenital examination or first speculum examination teaching stations. Because in these stations, you have to perform, you have to talk, and you have to involve your simulator also, right? In urine dipstick testing, you can it's people find I'm talking about the general point of view. People find it easier. It's a very common station. All of them are common, but urine dipstick testing is people find it are a bit easier. I don't know the reason, but for me, all of these stations were equally difficult and equally easy. However, um, so what I want to tell about, when you have a mannequin in front of you and you have to perform the procedure and you have to teach your simulator about it, the best thing is that you should position yourself in a way that you are able to look at your simulator and while performing the procedure. That is the key. And most of the time in GMC building, they place the model in a way that you are able to do that well. You can look at your simulator while talking, and at the same time you can perform the procedure. Because regarding the urogenital examination, most of the time they ask you to talk about genital inguinal hernias, or even about the scrotal examination. So your simulator you should be at an angle of 45 to or 90 degree from your simulator. That will help you. And the key, the most important thing is teach simple things, talk about simple things, don't go into complex concepts, don't talk about them, don't even give any clue regarding them while talking, in teaching stations. Because when you are going to teach them, will be under pressure. You might find it difficult to hold the speculum. You might find it difficult to examine the scrotum, or mention where the superficial or deep ring are placed. And you might not have practiced enough on the mannequins before your exam. Sometimes during these corona times, you don't find enough time or study and practice at academies. So keeping things simple will save you. And if your simulator is involved with you, and you take enough pauses after every concept. For example, if you talk about, see, this is the model, this is the this inguinal ligament. Now you pause for 3 to 4 seconds and look at him, and then say, this is the inguinal ligament, this is the place you will talk about deep ring, and you tell him about the landmarks, and then you pause. It's not important to ask question every time, is that okay? Or you ask any questions. No, just taking a small pause will help you. So these are the things that you have to keep that in mind. And regarding the teaching stations, uh, uh, subcutaneous injection examine in subcutaneous injection teaching stations, you will have a small model that are also available at academies too. And the subcutaneous injection video at Geeky Medics, it's a bit different from what you are going to have um, at the GMC. You know, they have pre-filled heparin injections. However, in Geeky Medics video, they tell you how to fill that syringe, or uh, how to discard it and all that stuff. So this is the only difference that Geeky Medic videos have, but otherwise the technique they are telling is quite good, and you can do a lot of things regarding, you can learn a lot of things from there. And the other thing regarding the abdominal examination, when you will start uh, reading or studying about the abdominal examination, many people will give you the concept in the videos and even in the scripts of different academies. They will start with hands. You know, always remember that in teaching station, you will have a mannequin with no hands. So don't talk about hands and the hands. If you have if you have spoon-shaped needles, that means this. If you have yellow nails, it means this. Or you will say that I will start with with examining your hands, your axilla, or your chest for some findings. So this is really important. And at the same time, at the end of abdominal examination, I'm going to examine your private parts. So this is how you are going to summarize the other examination that are part of abdominal examination too, you know. But you're not going to start talking about them having mannequin in front of you. No, you have to talk about the inspection, palpation, auscultation, and percussion. You have to start with inspection, and before inspection you have to start have to tell him that how will you approach a person where you have to exam you are going to examine, or how are you going to treat him. And it's important that you expose him properly, and presence of chaperone is important, consent is important. You will talk about them, and then you will go towards the inspection. And the one important thing that you should not forget, that you're not going to complete you're not going to complete this station at 8 minutes bell. There will be a few things you will be talking about, and the bell will ring. So you have to be safe by saying in the beginning of your station that, you know, ECG is a very vast topic, or abdominal examination is a very important and examination. We might not be able to complete it today, but I will definitely going to arrange another meeting with you, and we will complete the things that we missed, that got missed, or that or you can say that in an easy word. These are quite complicated words. In case we are not able to complete, ECG is a very vast topic, and it's difficult to talk about it in a single meeting. So what I'm going to do is I'm going to arrange some other meetings with you, and I will also give you some references and some where you can study more about it. So this is how you are going to tackle it. And the last is Epipen Teaching. Epipen Teaching is a bit different, because in this station, if you are talking about the data gathering of this station is different, because in this station you have to tell him about some emergency situation before talking about how to perform Epipen, how to use Epipen. You have to tell him some important things. You have to tell him that what you have to ask about a bit about the history, And if you are talking to the mother, you will say that I'm going to ask you a few questions regarding your child. Is that okay? And you will ask her that since when is he using and what are his symptoms, and you will ask him about if he is allergic to anything. These are the important things that you will ask. And if you are talking to your colleague or your junior FY1 colleague, and still you are going to tell him that these are the questions that you are going to ask. You will say that you have to take a brief history from the patient, or you should know Epipen is prescribed for these reasons. So and the ECG, urine dipstick testing, yes. And most of the people, they regarding abdominal examination, uh, if you in the abdominal examination teaching station, you have to the last point that afterwards I will summarize my presentation, that in abdominal examination every quadrant has some uh, in every quadrant there are some organs, and each organ has some common diseases. When you are talking about inspection, when you are inspection, you will say, for example, if you say there are 9 quadrants, still you will talk about the important quadrants, and then you will tell about the important organs they are in each quadrant. And it would be a good idea to talk about some important disease also. For example, if you say that in the this is the right hypochondrium, you have gallbladder and liver in it. Gallbladder, this the pain of the gallbladder will you if the person is having pain in his or her right hypochondrium, it might be because of the infection of the gallbladder called cholecystitis. So this is how you can manage the things. And I would say again that everyone has his or her own style. Everyone will have his or her own script. So you are the one who is going to decide that how are you going to talk about the diseases along with the findings and along with your examination while doing the examination. Thank you so much. I think I was about I had decided to talk about the ECT teaching station. So and anyone is interested um regarding the, I think Kuratulan, you mentioned that in the beginning that someone will do mock with me today, and and then I will talk about DC teaching station, something like that. I was not attentive at that time. So okay. Shaz, which difference are you talking about? Yes, Epipen is a very important, Sanji. Epipen is a very important station. I will do mock of this station and teach that station in another presentation. We have planned to Geeky Medics and GMC. Yes, yes, Charles. Regarding Geeky Medics and GMC, I was talking about a subcutaneous heparin injection teaching station. That in GMC, at GMC, you will have a most of the time, in not only in GMC but everywhere. Now that in Geeky Medics, they are giving you a concept that is a bit older, where you have to fill your heparin injection. But nowadays, you have pre-filled heparin injections, you have pre-filled Plexane injections, you have pre-filled insulin injections at some point, and you will so you don't have to fill that. You don't have to teach how to fill your syringe. You will just say that this is the pre-filled heparin injection, and now I'm going to teach you how to give subcutaneous injection. This is how you are going to say that. You are not going to teach just like in Geeky Medics. They say that Now you will take the heparin ampule and you will check the expiry date, and then you will fill your syringe like this, and then you will remove the air. No, this is not something you are going to talk about in your teaching station in PLAB exam, because they most of the, because pre-filled injections are quite common nowadays. I'm not sure about aromatics. I'm sorry. I haven't used this source. I'm not sure. I haven't heard IMEDIC's name before. So anyone who is interested in mock of ECG teaching station, please raise your hand or type your name. I will teach him, because I have a few. I have to talk about ECG teaching station. So it would be a great idea if people. Yes, Maria. It would be a great idea if you first someone perform the station, and then I will teach you regarding the ECG teaching station, because it's quite common. It's a very common station. So, and there are a lot of, you always have a lot of things to talk about, but still you should not talk about all those stuff, because that will complicate the things. So, Maria, are you with me?
Yeah, I'm here.
Okay. So, do you have the GMC bell?
No, but I can put timer of 7.5 minutes.
Okay. Let me see if I may have that bell.
And I'm doing this station for the first time.
Okay, that would be great. If you are doing it for the first time. Okay, is there, along with Maria, is there anyone whose exam is closer, so that he or she can also perform, because they have read about the ECG teaching station, so they will be, I will be in a better position.
Yeah, my exam is in the 8th of June. I want to perform.
Sorry, I didn't. Who just?
Hina. It's Hina.
Okay, Hina. Okay, Hina and Maria. Maria, I think Maria, you should perform first, and then Hina will perform, because Maria, are you there?
Yeah, I'm listening.
Okay, okay, Maria. I will give you you have 8 minutes.
Okay.
And this is your. Can you see the scenario?
Yes.
Okay. So the student nurse name is not mentioned here, but I can tell you the student nurse name is Samantha. Okay.
Samantha. Okay.
Okay. And I'm going to start the GMC bell. Okay, I'm sorry, I can't find it in my phone, so I have to start the timer.
Doctor, I have timer. I can put the GMC building for GMC bell for you.
That would be great. Please, Ahmed, start the bell when I say that. Okay. Okay. So, Maria.
Yes.
Can you just let me know if you can hear the bell?
Okay.
Dr. Ahmed, please start the bell.
Yeah, I can hear it.
Okay. Okay. Now let's start the station, and your time starts now. Dr. Ahmed, please restart the bell.
Okay, doctor. 1 second.
I'm Dr. Maria Sayed, and my GMC number is 1234. Hello.
Hello, doctor.
I'm Maria, and I'm one of your colleagues. I understand you are Samantha?
Yes, doctor, I'm Samantha. I'm student nurse here.
Nice to meet you, Samantha.
Nice meeting you, Dr. too.
And Samantha, how is your studies going?
Doctor, it's good. I'm learning a lot of things working here. So yeah, it's good.
Well, nice to hear that. Well done. And Samantha, I understand you are here to learn about the ECG. Am I right?
Yes, doctor, I am.
And may I ask any specific particular reason?
Well, doctor, actually, um, while working in ER, sometimes I find, people, there are patients, the doctor asks me to do the ECG, and sometimes they are not around or busy with other patients. So I just want to know about some basics of ECG so that I am able to say that if this patient is serious or not.
Well, I must say that that's a wonderful initiative you are taking. And
Yeah.
thank you for showing interest in this topic.
Yes.
So Samantha, just one thing before we start is that it's a very vast and a very important topic. So if we are unable to cover it today, we can arrange another session and we can discuss the rest of the things in that. How does that sound to you?
Doctor, that sounds great.
Okay. So Samantha, do you have any idea or have you done any reading regarding ECG?
Well, doctor, actually, I just know that we can, you know, learn about different heart abnormalities with from ECG.
Well done. That's right. So do you know, like, let me tell you that ECG, it's basically the electrical activity of the heart. And we traced it on the paper. And you rightly mentioned that you have been doing it in the emergency department. So you must be aware about that. Am I right?
Yes, doctor, you are.
So any idea about the conducting system of the heart?
No.
Okay, then let me draw a heart for you.
Yeah, sure, doctor. You
Okay.
can on. You can on your camera.
Oh, 1 second. Let me draw a heart for you. I have turned on the camera, but I don't know how to show you.
Okay, I can see that.
Okay. Okay. So this is you can see that this is the right atrium and this is the right ventricle. And this is the left atrium and the left ventricle. So in the right atrium, there is this SA node. And here the impulse begins. It goes towards your right ventricle by the AV node and then to the Purkinje fibers into the ventricle. Okay.
Yes, doctor.
So in the ECG, look, I'm drawing this ECG. This is P wave, this is QRS, and this is T wave. So are you getting me?
Doctor. Yes, doctor, I am.
So this P wave, it's basically when the atria contracts. And this QRS complex is when the ventricle contracts. And the T wave is when the ventricle relaxes. And you know that atrial relaxation is hidden in the QRS complex. So you cannot see it on the paper. Okay. So do you know what the normal heart rate is?
No, doctor.
Okay. It's 60 to 100 per minute. And anything less than 60 is called bradycardia. And anything more than 100 is called tachycardia. Am I clear so far?
Dr. Reddy, what does that mean?
Bradycardia. Brady means low. Anything less than 60 is called bradycardia. And cardia is from cardiac. And more than 100, it means tachycardia. Brady means that the heart rate is less. And tachy means that it's very fast. Okay?
Okay, doctor.
Okay. And Samantha, if any point of time you notice that the patient is having too slow heart rate or too high heart rate, inform the seniors right away, okay?
Okay, doctor.
And you know that these patients in a cardiac unit who require ECG, you know what they present with what complaints they present with?
Pain, maybe?
Wonderful. You're very right. They do present with chest pain, heart racing, sweating, shortness of breath. Okay. Okay, Samantha. Now let's calculate the rate of that ECG strip. Is that okay?
Okay.
So first, what we will do is that we are going to find out that whether it's regular or irregular. We can use a separate paper like I'm using it, and we'll mark it on the R wave, and the distance between the two R waves, which are subsequent to each other, we have to find out. And if it remains the same, it means that it is regular. Am I clear?
Okay, doctor.
Okay. And next thing is to find out that after what's the heart rate is. So you can see that, okay, and you can see that there are two R waves, okay? So what you will do is that you will count the number of big boxes between these two R waves, and you will divide 300 by the number of big boxes between the two R waves. It will tell you about the heart rate. Is that clear?
Okay, doctor.
Samantha, any questions you have for me at the moment?
Doctor, how can I say that a person is having heart attack by looking at ECG?
Yeah, that's a very great question. So you can look at this ST segment, this segment over here, which I'm showing you. Okay. Whenever this segment is about two small square above elevated, okay, it's above or elevated, it is known as elevation of the ST segment, okay? And at that point of time, it depicts that one has myocardial infarction or ST elevation MI. As the name is quite evident itself, ST, which is the ST segment, elevation raised, and MI is the myocardial infarction. And at that point, you have to inform your seniors immediately. Am I clear so far?
Okay, doctor. So that means that I have to tell my seniors whenever there is some ST segment elevation.
Yes, you have to attach the oxygen. You have to check the vitals of the patient. You have to give some painkillers after senior advice and some blood thinners as well. But it should be after the advice and under the supervision of the senior. Okay?
Okay, doctor.
Okay. So Samantha, as there, like, we can discuss one more thing as we have a time left. So okay. Okay, doctors.
Maria, it was a good attempt. And your, first of all, it was a good attempt for someone who is performing for the first time. I think you're talking about from the very start, the data gathering. You you have said to me that, hello, my name is Maria, one of the junior doctors, and you must be Samantha. I made that easier for you by telling you that yes, I'm a nurse here. So you told me that yes, it is that I'm here to learn about ECG. You told me that you know that, and afterwards you talked about the rate. You talked about rhythm. I was not sure you were talking about rate. Your speed was very good. You were very good about the teaching station. But at some point, while talking, I think that you can involve me more, although your involvement was appropriate by taking some pauses. You know,
Okay.
otherwise it was good. And you didn't talk about the ECG pattern. You didn't talk about the. You just told me about the ST elevations. You didn't talk about the P wave, QRS complex, the T wave. That is very important. Whenever you start talking about ECG, you have to talk about briefly about the structure of the ECG.
Yes.
Okay.
I'll note that down.
You talked about that you will measure number of big boxes in between two R, but I have no idea what does R means. Okay. You talked about the conducting system, but from there you just switch towards the rate. But that's not right. First talk about the ECG structure. That the ECG, this is how the ECG pattern looks for a single heartbeat. You know, you can see there are some ups and downs. This is the graph paper. This is
Mm-hmm.
there are a few waves. Someone are pointing towards pointing upward, some are pointing towards down, and every deflection signifies some heart activity. You know?
Okay. The Dr. Saima, can I, like, I was drawing the ECG over here, so can I draw that in front of the
Yes,
in
you
front
have
of
to
this
draw.
Mantha as well, and I can like show that, look, this is how it looks like, and this wave tip shows this.
Hmm.
Excuse.
Maria, you have to draw it. No, you
Yes.
have to draw it, no matter what. Because I have mentioned in the scenario that inside cubicle you have pen, you have papers, you have random ECGs on the table. You know, when you have pen, paper, you are expected to draw the ECG pattern because you will be sitting at 2 feet distance from the simulator, and she is or he is not going to give you any ECG in the beginning, most likely because he has to come toward you. You know, so you will have a table with your chair, and there might be a few ECGs if you are expected to talk about. Other, if there's no ECG, you will have a pen and a clipboard with a lot of papers on it, and you are expected to draw the ECG pattern. Okay.
Excuse me, Dr. Maria, regarding heart shape, we have to draw the shape of heart in SA and AV node, or just we can verbalize, and then actually I think this ECG paper and ECG tracing, that is more important if we have to draw.
Yes.
What do you think?
Yes.
What is your
Yes.
recommendation on this?
This is something I
Yeah.
was the next that was the next mistake I was about to mention, that you talked about a conducting system of the heart. Before that,
Yes.
you should have mentioned about the parts of the heart: atria, ventricle. These are the most important, and that there are two atria, there are two ventricles of the heart,
Mm-hmm.
and you know the contraction of these parts of the heart. They are they're electrical. They are uh, these contractions and relaxations of these parts of the heart, they are detected via ECG. You know, and then you will talk about that this is as this is the electrical activity, it is produced by the conducting system of the heart. Do you have any idea about it? You can talk about it, but I will suggest that it will only complicate your teaching station if you will talk
Yeah.
too much about it. You should
Okay.
keep that simple, because you are talking to, you're not talking about ECG or heart conducting system in a medical school class. You are teaching ECG concepts to a nurse colleague. She doesn't
Yeah.
care what the SA note is, what the AV note is. She cares. She told you that she want to know about basic concepts so that she is able to differentiate between serious and non-serious situations while working in the
Mm-hmm.
ER. Okay, so
Yes.
this is very important that you do not use you told me about the conducting system, and but you didn't completed that concept. You just jump towards the rate and rhythm.
Yeah.
So this is something that is very this is where homework is very important, that you have to decide that how are you, what are you going to talk about, and how are you going to talk about it. Okay.
Okay. So, Dr. Saima, is that okay if I skip like the conducting system of the heart and I just draw the ECG and I just start with the P wave?
You know, you can say that you know heart is you can say it like this, that instead of talking about the whole complex conducting system of the heart, you can say that heart has four parts: two atria or two ventricles. They contract because of some electrical activity that is conducted by the system that is present in heart itself, and it is detected on the by ECG machine, and it gives the, and you can say it like this. You know, this is a way I this was my way of telling that, you know, that heart is the contractions of heart, they are heart contracts because of some electrical activity that is produced within the heart by the conducting system, and it is detected on ECG, and it has pattern like this. You see there are some waves, there are some positive waves and the negative waves. Each of them signifies some electrical activity of the heart. This is how I said that.
Okay.
I didn't talk. This was my script when I prepared for the exam. Because I personally believe that if you start talking about the conducting system, you will get lost in that part. You will not be able, because there is nothing you can talk about regarding management while talking about the conducting system. If someone has a way to, talk about the management points, talk about the decisions while talk about SA node and AV nodes, then he or she can do that if he thinks that he can do that. But I think that that will lead to some complicated diseases like that will even more complicate your teaching, because the simulator in front of you, if he is understanding your thing, what you are talking about, he will give you a response. Otherwise he will be sitting there as if he or she is not there. So that is not the that is not going to help neither you nor he or she, because they also want to help you. Because if you are making things complicated, they stop helping you at all.
Okay.
Doctor,
Thank you,
excuse me.
Dr.
Your meeting, I think it is showing about 1 minute 40 seconds. Am I allowed to say something if you don't mind?
Yeah, sure, you can.
Yeah. Okay. What if we can start like this, that okay, Samantha, the heart is controlled by the electrical activity, and we can study heart by tracing this electrical activity on a graph paper. Are you with me? Okay. This is the graph
Yes.
paper. This is the graph paper, and it has small and the big boxes. Do you have any idea about small and big boxes? Then we can give the timeline, and then we can teach her how to calculate the rate. Actually, if we can address rate, rhythm, and we can discuss the ST elevation, like the acute heart attack, I think then we can get some credit on this station.
Yes, absolutely. This Dr. Jas, your approach is absolutely right. Until and unless you don't get distracted while talking about the big and small boxes, and your
Yeah.
time doesn't get wasted.
Yes.
And you get appropriate time to talk about rate, rhythm, or ST elevations, and you are able to score well in management by talking about the possible emergency situations or the possible diseases.
Yeah.
While talking about these things, you're absolutely fine.
Can I add
Okay.
Can I add a thing here?
Yes, please.
Okay, Dr. Ijaz, actually the thing is you are talking to a nursing student, okay? So I will advise you to go for simple things. If